Hope your work week is off to a good start. It's Monday, November 1st here in Korea and you're watching the Daily Report. I'm Min Sun-hee. After more than 600 days of COVID-19 related restrictions, Korea is now taking its first steps out of the pandemic and into a new normal. We cover these efforts today after a look at the global pandemic numbers with our Kwon So-ah. So let's begin here in Korea for this Monday then.
All right, Sunny. So before checking Monday's figure, as you mentioned, this 1st of November is the first day of a phased transition into normalcy, which means a number of eased social distancing measures, and that thanks to the recent achievement of fully vaccinating 70% of the nation's population. We will have more on the details on what has changed starting this Monday. Before that, let's take a look at the figure that was tallied as of 12 a.m. 1,686 cases were counted, and that includes 1,666 domestic transmissions and 20 cases from abroad. Now, the capital Seoul has posted more than 600 cases, over 500 in Gyeonggi-do province, also a triple digit in Incheon. So still most cases concentrated in the metropolitan region, but also we've got at least a single-digit number of cases in all 17 provinces or major cities here in the nation. Now, since last Thursday and throughout the weekend, we've been seeing infections at above 2,000. Now, that has gone down now this Monday, but we usually have a lower figure on Monday. And actually, if you compare the figure to the past Mondays, it is a surge from the past weeks. Now, let's move over to this figure here. 1,882 is the average number of daily domestic cases, and when we include the number of imported cases, that figure now stands at 1,900. Now, the total number of infections here in the nation stands at 366,386 with 2,858 fatalities. And from now on, the number of people that are in severe or critical condition is what the government will specifically look at. And as of this Monday, we've got 343 patients in such condition. Now, let's move over to some positive figures on the vaccination front here. 80.1% of the nation's population has received at least one jab, and 75.3% are considered fully vaccinated. Moving on abroad, we've got a grave milestone that has been hit over the weekend. Now, more than 5 million people have so far lost their lives due to COVID-19. And also what has happened over the weekend is the UK has hit 9 million cases in total, Turkey 8 million in total, Colombia 5 million, and Poland 3 million. All of these milestones happened over the weekend. And also the Ukraine here at 2.9 million infections has surpassed South Africa in its total caseload as of this Monday, Korea time. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, so it's D-Day here in Korea as we move beyond pandemic-related restrictions towards a new normal that urges a safe and sustainable life amid COVID-19. For more, I have On Jung here in the studio. Welcome back, On Jung.
Good afternoon.
Right, so let's begin with a reminder about the major changes in place starting on this Monday here in the local front.
Yes, let's begin with the private gatherings now. Take a look at this up on your screen right now. Regardless of their vaccination status in the greater Seoul area, social gatherings of up to 10 people with 6 of the group fully vaccinated are allowed at restaurants and coffee shops, with up to 12 people allowed in other areas as long as 8 people are fully jabbed. But you need to remember that cafes and restaurants, those who are not vaccinated, can only meet in groups of up to 4.
Right, then. Won Jung, do tell us again about the operation hours at dining establishments, that is, including cafes here in the country.
Sure. So I'm sure this question, many people are curious about this as well. Take a look at this up on your screen again. In the Greater Seoul area, on the level 4 social distancing, the cafes and restaurants had to close by 10 p.m. starting Monday. Those limits have been lifted so they can operate around the clock. But for those considered as a high-risk facilities such as clubs and a few types of bars, they can stay open until midnight.
Right. And speaking about high-risk venues, On Jung, proof of vaccination or a negative PCR test need to be shown there, right?
Right, the so-called vaccine pass is required when entering places that are exposed to the high risk of COVID-19 exposure. Now, we're talking about singing rooms and saunas and gyms, bars, plus hospitals. Proving your vaccination status is simple through an app called gov't by using Naver or Kakao or the paper documents issued by the local health centers. Regardless of your vaccination status, you can also show your negative PCR test result taken within the previous 48 hours, but there's a 2-week grace period until the November 14th, so to help the ease of transition process. Also, some exceptions will be provided if you're under 18 years old or unable to get vaccinated due to underlying conditions. There's also some good news for moviegoers and sports fans. If you're fully vaccinated, you're now allowed to eat popcorns and drink at theaters and get chicken and beer at baseball games.
Right, that is good to know. On Jung, also tell us about the changes within the academic arena.
So there's a gradual transition for schools too. Now, starting November 22nd, the first Monday after the National College entrance exams, in-person learning will resume for all students, including those in college. Now, this is after a year and 8 months since the online classes kicked off in April last year. So it's just a big gap.
Right. Meanwhile, on the vaccination front, as I mentioned, we have more than 75% of the population here fully inoculated. What is the latest there?
Sure. Starting Monday, children aged 12 to 15 in Korea have become eligible to get the Pfizer shot. And according to health officials, around 490,000 children have signed up, which is only 27% of those eligible. The vaccination will start from November 1st until November 27th, and Korea's booster shot program also has started for people with a weakened immune system, including leukemia patients and people who've had organ transplants.
Right. Well, hopefully the vaccination registration rate for those children between 12 and 15 will increase in the coming days. On Jung, thank you for now, but stay with us for the broader talks. Right. Now, for the latest government remarks on the COVID-19 situation and efforts to ensure a productive exit strategy from the pandemic, I have Swa back at the desk. Swa.
Yes, Sunny. So as we have transitioned into this so-called living with the COVID-19 scheme, the government's briefings are going to look a little different as well starting this Monday. Rather than putting an emphasis on the daily number of COVID-19 infections, the focus will be on the number of patients in severe or critical condition, deaths, and also medical capacity. So based on that, Park Kyang, an official at the Health Ministry, started the earlier COVID-19 briefing by sharing figures of hospital beds available for critically ill patients, with close to 55% vacant as of this Monday. Some 59% of beds at residential treatment centers are available, while over 2,800 patients are recovering at home. There has been a slight drop in the number of people in serious or critical condition in the past week as of October 24th, but the number stands at above 300 for the 5th straight week, with over 74% of them being people in their 60s or above. The number of people who died in the span of the same week stood at 85, a drop from 101 the week before. Now, it is a drop, but Park Kyang mentioned that weekly deaths are still higher than those that occur among patients that are patients of the seasonal influenza. In fact, she said that average stands at around 40 to 60 deaths a week, so still COVID-19 deaths are much higher. And she also mentioned that having up to around 500 patients in severe or critical condition, at that state, medical capacity won't be strained. And also, as the number of people with milder symptoms is expected to go up, authorities are looking to make home treatment more effective. Let's take a listen.
We are making some minute adjustments to our guidelines regarding the age requirements for home treatment. When it comes to other factors like vaccination, we will be working closely with medical staff in deciding whether a patient should be treated at home or be transferred to a hospital following an examination. The patient's living environment will also factor into our decision.
Right, so our medical capacity at the moment appears to be stable, but officials have been observing an uptick in daily infections over the past week, right?
Yes, Sunny, unfortunately so. We are entering this new scheme with quite concerning figures and with a spike of cases attributed to the following.
We believe the easing of restrictions, the anticipation of a return to normal, and the fact that more people are gathering in poorly ventilated indoor space amid the drop in temperatures have all contributed to the rebound in cases. This is seen to be a large outbreak when considering the fact that fully vaccinated people greatly outnumber those who haven't been vaccinated, with the latter comprising the majority of recent cases.
According to government data, Korea posted an increase by some 28% in COVID-19 cases last week compared to the previous week. Also, the reproduction rate of the virus has been going up, standing at 1.03 as of late, while it was standing below 1 for the previous 3 weeks. A number above 1 translates into a rising trend. While looking forward to the gradual return to normalcy, officials reminded the public that individual compliance to hygiene measures and basic guidelines like mask wearing will play a big factor in the infection figures from here on.
Right, and talking about infection figures, I understand there's been a grim forecast regarding the daily tally as we take our first steps out of the pandemic. So tell us more.
Right, Sunny. So usually government officials have been refraining from making predictions of specific numbers. It was rather health experts who have been doing so. But Son Young-nae, a senior health ministry official, said earlier this morning on a radio show that figures could double or triple in the future as we are transitioning into this new scheme. And also saying that at around 5,000 daily cases, medical capacity would be strained. But what he also made clear at a following briefing was this.
Whether we have 5,000 or even 10,000 daily infections, the important figures we need to focus on are the distribution of cases between the fully vaccinated and the unvaccinated, and also the number of infections among the elderly.
Well, 5,000 or 10,000 cases, I hope that those predictions will not materialize.
Right, I join your thoughts right there. Right then, our extended talk today will begin with the focus on vaccinations, and for that, I turn back to On Jung. Now, On Jung, you mentioned earlier that children aged 12 to 15 are next in line to get their Pfizer shots starting today. What are the chances of other vaccines being used?
So right now, children in 12 to 17 in the broad area in South Korea are only eligible for the Pfizer vaccine. But looking at other countries in the U.S., the FDA has authorized to use a Pfizer shot for children 5 to 11. Of course, they're waiting for the approval from the CDC right now. But interesting thing is that the FDA has not yet given the green light to Moderna shot for teenagers. Yes, there are some reports saying they're looking at this possible side effects that link to the maybe myocarditis. So we'll see how their decision might change over the course of time. So
I see, so we'll have to wait and see that. Meanwhile, Soa, I hear there's been a surge in violations of COVID-19 related restrictions during the Halloween weekend.
Right, that was something that government officials have been fearing, and it looks it has happened, although they have been had those stringent inspections throughout the Halloween period. So over 1,289 violations were recorded by Korea's National Police Agency, and most of those in the capital region. Especially many people have been crowded in Seoul's Itaewon district, which is popular for celebrations regarding Halloween. But not only in Seoul, also in Busan, there were hundreds of violations that have happened. So officials are stressing that people who have been gathering at such places should try to get tested for the virus, especially if they are unvaccinated. But it's not only here in Korea, but Halloween this year looked quite different from last year around the world. It was also many people in New York City or London where big celebrations were cancelled last year, and those have been now held due to the living with the COVID-19 strategy.
Right, I see. Well, here back on the local front, I guess effects of the violations during Halloween we'll see in about a week's time then.
Yes, a week or two, I believe.
Right. All right. So as always, thank you very much for that. And On Jung, thank you for being here today.
of course.
In our headlines at this hour, President Moon Jae-in is scheduled to attend the 26th UN Climate Change Conference of the Parties, also known as COP26, on this Monday over in Glasgow, Scotland. Now, prior to heading there, he took stage at the G20 summit in Rome this past Sunday to reaffirm Korea's commitment to go carbon neutral by 2050. Meanwhile, during the COP26, participating countries are expected to share their efforts to stem greenhouse gas emissions and address global warming. Also, at the G20 summit in Rome this past weekend, participants agreed to tackle disruptions in supply chains during a meeting led by U.S. President Joe Biden. Our Chang Tae-yeon reports.
U.S. President Joe Biden hosted a supply chain meeting on Sunday during the annual gathering of G20 leaders. Discussed were ways to make pandemic-hit supply chains more resilient amid bottlenecks hampering the global economy.
Supply chains are something that most of our citizens never think twice about until something goes wrong. And during this pandemic, we've seen delays and backlogs of goods from automobiles to electronics, from shoes to furniture.
He added that ending the pandemic is the ultimate key to unlocking the disruptions, urging that action must be taken now. Biden said that vulnerability in the current system means there cannot be a return to business as usual and stressed the importance of being prepared for the future, as COVID-19 will not be the last health crisis. The U.S. president, along with leaders from 14 other countries and the European Union, agreed to foster greater international cooperation on near-term supply chain disruptions. In the meantime, South Korean President Moon Jae-in was the first person to make a comment after Biden's opening address. The U.S. has previously set the order of speakers, and the Blue House has said that this signifies South Korea's importance in recovering the global supply chain system. Aligning with President Biden's remarks, President Moon said stable global supply is urgent for a complete economic recovery. He added that the global logistics crisis is quickly becoming the biggest unstable factor in the global economy and joint action is needed. The South Korean leader also said to solve the logistics issues, international society and private companies have to find alternative transportation methods, manage transportation schedules, and share information. He said that South Korea is working on strengthening the cargo handling process and building joint distribution centers to tackle supply chain issues. Chang Tae-yeon, Arirang News.
And leaders of the group of 20 leading economies have also officially extended their support of a global corporate tax reform plan spearheaded by the OECD that seeks to ensure multinational enterprises pay their fair share of tax. Kim Yo-sun has more.
The leaders of the world's 20 wealthiest nations have formally endorsed a global minimum tax of 15% on big multinational companies during their first in-person meeting since the pandemic began. U.S. President Joe Biden hailed the deal as a, quote, game changer that's going to reshape the global economy. The most prominent feature of the deal, part of a reform plan inked by some 140 countries, is the 15% global minimum tax. This rate will be applied to multinationals with annual revenues of over $867 million, aiming to discourage companies from being able to avoid paying taxes by finding havens in other countries with low rates. Another vital part of the agreement is that it allows countries to levy taxes on large and profitable companies, not based on where they operate, but on where their goods and services are sold. The OECD, which is leading the initiative, estimates the scheme will generate $125 billion in additional global tax revenues annually after it comes into effect in 2023. Visit ads will be reallocated from about 100 of the world's largest multinationals, which could also include South Korea's Samsung Electronics and SK Hynix. The Wall Street Journal reported the major beneficiaries of the deal are likely to be rich countries, including the U.S. It explains Washington's additional revenues will be 15 times those of China. Kim Yo-sun, Arirang News.
In neighboring Japan, the ruling Liberal Democratic Party retained its majority in the country's general election this past Sunday, defying earlier forecasts. Here's Peunji.
Japan's ruling Liberal Democratic Party held on to its majority in Sunday's parliamentary election, solidifying Prime Minister Fumio Kishida's position. Initial exit polls suggested the LDP could lose its sole majority, but the result defied expectations and the party retained control of the lower house. LDP won 261 seats in the 465-member lower house of parliament. Although this is fewer seats than the party held before the election, it easily exceeds the 233 needed for a majority. The LDP had 276 seats before the election. When combined with its junior coalition partner gov't, the party secures seats required for an absolute stable majority, making it easier to pass bills. Prime Minister Kishida told reporters that his administration would attempt to put together an extra budget this year. But as for ties with South Korea, one expert says there's not going to be a breakthrough anytime soon.
Prime Minister Kishida and President Moon Jae-in had a phone conversation a couple of weeks ago, but it was reported that Kishida was very adamant about comfort in women issue and the forced labor issue. So I don't think there's going to be any breakthrough in Korea-Japan relations in any time soon.
The election was a test for Kishida, who became prime minister early last month, and his long-ruling Conservative Party, which has been slammed by its perceived mishandling of the pandemic. A poor showing would have heightened expectations that Kishida could follow his predecessor Yoshihide Suga in becoming another short-term premier. A big winner in the election was the conservative Osaka-based Japan Innovation Party. The party is projected to surpass gov't, becoming the third most powerful force in the lower house, after the opposition Constitutional Democratic Party of Japan. Turnout is forecast to be 55%, higher than the last election held in 2017. 배은지, Arirang News.
In other news, a collection of educational materials on North Korea will be made available to middle and high school students in the U.S. starting next year. U.S. nonprofit, the World History Digital Education Foundation, disclosed on Sunday, plans to distribute materials on the geography, economy, history and culture of North Korea across the U.S. academic arena. The foundation has underscored the need for teaching aids on the regime and on Pyongyang-Washington relations amid growing interest in North Korea. A group of North Korea experts, including Jenny Town, managing editor of 38 North, took part in the project. The country's annual shopping sale, better known as Korea Sales Festa, is currently underway. During the next 2 weeks, more than 2,000 companies and all 17 regional governments here are partaking in this nationwide event. Now, this is said to be the largest number of participants since the event began 5 years ago. Firms including Samsung and LG are offering up to 40% discounts on home appliances such as TVs and washing machines. Also, some 30 companies are slashing prices of furniture by up to 50%.
Let's take a look at what's going on in the world now. One of the largest mosaic panels in the world has finally been unveiled after $12 million and years of restoration at Hisham's Palace in Jericho in the occupied West Bank. The massive piece was unveiled by the Palestinian Ministry of Tourism and Antiquities on Sunday, showing an Umayyad-era piece with 38 carpet-like mosaic panels covering a total of 827 square meters. To ensure visitors can enjoy the site without treading on it, elevated platforms were built. The ministry hopes the mosaic piece will increase the number of tourists in Jericho.
We are proud of the opening of one of the largest mosaics in the world, and hopefully this will increase the number of tourists who visit, whether specialists, architects, or regular tourists to this location.
According to the ministry, the dome was made out of eco-friendly material, which works as an insulator, able to maintain temperature in a manner that preserves the mosaic floors. Ahead of the COP26 climate summit in Scotland, the French branch of the Extinction Rebellion Environmental Action Group held a Halloween-themed protest in Paris on Sunday. The protesters in costumes and face paint gathered at a shopping center in the French capital, warning of the horrors of climate change inaction.
We all live in a single biodiversity, and that means it's not humans versus nature. It's humans and nature. If we don't change our way of life now, we can't continue on like this, and we'll meet our end very quickly.
The protest comes as world leaders will hold the COP26 summit on Monday, with 2 days of speeches that could include some new emissions-cutting pledges. Halloween was no laughing matter in Japan, as a 24-year-old man dressed as the Joker attacked passengers on a Tokyo train line on Sunday, injuring 17 people before he was arrested on the spot. According to local media, a man in his 60s is in critical condition after being stabbed, while witnesses also say the attacker had sprayed fluid around the train and started a fire. Some of the passengers thought it was a Halloween stunt before seeing the suspect holding a bloody knife. The attack occurred on the Keio Express line bound for Shinjuku, the world's busiest railway station, as many partygoers were headed into the city center for Halloween gatherings. Lee Seung-jae, Arirang News.
It's day one of Korea's phased transition into a new normal, and long lines are expected in front of screening centers nationwide as unvaccinated people are now required to submit negative PCR tests to access some venues. For more, our Chun Song-cho is out on location. Song-cho, hello, and do start by telling us where you are.
Yes, so I'm at a drive-through COVID-19 testing center in Seocho-gu district. Today is the first day of implementation of the Living with COVID-19 strategy, but still quite a number of people are getting tested here today. I'm sure you're already familiar with this type of roadside testing centers by now. I mean, this is what South Korea was praised for in the beginning of the pandemic by the entire world for coping with the explosion of COVID-19 cases in such an innovative way. So here, people don't have to get out of the car at all. Healthcare workers will do all the testing for you, as you can see over there. It's such quick, safe, and easy way. And this also ensures minimizing unnecessary contact between people, hence just making it safe for everyone involved. So I'm going to talk to one of the healthcare workers here and ask him if he has any words for the public. 안녕하세요.
네, 안녕하세요.
네, 이쪽으로 나와주시겠어요? 네, 감사합니다. 이제 오늘 코로나 위드로 전환이 되었는데 확산세가 아직도 계속되고 있어요. 의료진으로서 저희 시청자분들께 하고 싶은 말씀 있으실까요?
예, 오늘부터 본격적으로 위드 코로나가 시작이 됐습니다. 의사협회에서는 갑작스럽게 방역 조치가 해제가 되면서 확진자 숫자가 급증할 것이라고 이렇게 예측을 하고 있는데요. 이제 그만큼 우리 국민 여러분들께서도 방역 조치를 잘 지켜주시고 의심된 증상이 있으시면은 바로 선제 검사 받으러 와주시길 당부드립니다.
감사합니다. Alright, so he said that with the launch of the Living with COVID-19 scheme, healthcare workers are expecting a resurgence of COVID-19 cases. So please follow public safety guidelines. And if you show even the slightest symptoms of COVID-19, then please stop by one of these testing centers. Getting tested is as crucial as getting vaccinated if we ever want to slow down the spread of COVID-19. This has been Chun Song-cho reporting live from Seocho-gu district, and back to Sunny in the studio.
All right, Song-cho, thank you very much for the coverage. Social distancing measures in light of the pandemic are being eased to make way for a new normal about a year and 9 months since Korea's first COVID-19 infection. For more on the country's exit strategy, I have Professor David Kwak from Sooncheng University. Professor Kwak, welcome back.
Good afternoon, Sunny.
I also have Dr. Kim Seung-taek from Institute Pasteur, Korea. Dr. Kim, good to see you again.
Good afternoon.
Right then, Professor Kwak, Korea's first set of pandemic-related restrictions were imposed exactly 611 days ago. And today we are starting our phased return into a new normal. What are your thoughts?
Well, kind of obviously, I have mixed feelings. I'm both excited as an individual citizen to finally take a step, something that's going out of the pandemic era and going into the new phase possibly living with corona. I would hope that this step would make the economy go back to normalcy, have everyone happy, and live healthily, obviously. But as a medical doctor, I still have to be worried because these easier restriction guidelines would obviously mean many more people will come into one place and come together, possibly exposing them to further infections and whatnot. So we should probably expect to see more confirmation cases as the government is already anticipating. But I dearly hope that that won't increase the numbers of people who are having severe diseases from it, and also the mortality rate will relatively stay low. But this also means that it's an era that we have to really look after ourselves. It means that for those people, especially with underlying diseases and immune weakening issues, they would have to be extra careful, still keeping very strict those social distancing guidelines. But for others as well who are actually going back to their work or who are going to more of in-face situations rather than before, they should also look after themselves, and for others, still keep a very strict social distancing guidelines as well.
Right, so we have to be careful. Dr. Kim, my colleagues who I mentioned earlier, the authorities here, are expecting the daily tally to hit as high as perhaps even 6,000 or 10,000 cases as we begin our transition into a new normal. Do you share this outlook?
Well, I can't tell the exactly numbers as confirmed cases for now, but it's one of just the possibility. And then the key thing when we actually transition into some just a phase one, this sort of just living with COVID-19 is that sort of just slowing down just the spreading of the viruses. That's the key issue. Otherwise, we are actually the numbers just easily just overwhelm the number of just our healthcare just a facility. So then that is the issue, and then there is just a number of just variables that might just affect the number of just confirmed cases as well. Like we actually discussed maybe earlier, we are actually approaching to just a winter. This is winter, and then this is typically the season of just it's actually just we observed many just respiratory viral infections, such as now just the coronavirus, but also just the influenza virus as well. And then there was actually last weekend we also see a lot of people just outside in the Halloween just a party. And then that also, this kind of things actually can be actually determined by our own just the responses. So that our response to these viruses will determine by basically just the number of just confirmed cases and also just the kind of a capacity that you can actually deal with.
I see. So ease measures also leads to, I suppose, a greater sense of responsibility on members of the public.
Yeah, right.
Professor Kwak, our exit strategy consists of 3 stages with an interval of 6 weeks between each stage. Is this an adequate interval in your view?
Well, personally, I think 6 weeks is good enough, given that they would have 4 weeks of trial and implementation of the new social distancing guidelines, and then 2 weeks to review that retrospectively very thoroughly, hopefully. I don't think the nature of the virus is that it changes over time in months of calculation of the period. Meaning, if you take a month to implement it and have 2 weeks to really review it, it doesn't really matter, because if there was to be a massive cluster infection, that'll probably happen within a couple of weeks or so, especially with the Delta variant that we're having that's transmitting much faster than before. So I think giving it about 4 weeks of implementation period is sufficient in my thinking, and also 2 weeks to review it thoroughly before going ahead with the further steps, I think is appropriate.
What are your thoughts on the expanded number of people for social gatherings, Professor Kwak?
That's a particular issue that I'm kind of worried about. When they expanded the number to 12 people or 10 people possibly in the metropolitan to gather together at a time, I'm not concerned about that too much. But they've started allowing up to 99 people or 499 people to gather for conferences or religious gatherings and whatnot. That could possibly become a source of cluster infection or possibly massive cluster infection. I'm not saying they should limit it or they should restrict it, but they should at least give them much harsher warning that if people were to gather in even larger numbers, there is greater chance, especially in a confined space, for a super spreader to happen and end up in a very big manner of confirmation cases. Maybe, as I have been saying numerous times before, they should probably also come up with a physical method to approach this, meaning for those places that have, let's say, hundreds of people or 500 of people, they should mandate them to open their windows completely, 100%, and every time that they meet. So I think still that they should take into deeper consideration of these physical aspects of transmission of the virus.
Right. Meanwhile, Dr. Kim, unvaccinated people have the option of submitting a negative PCR test to access some venues. Now, it takes about a day for the result of a PCR test, which is why some people are urging for the adoption of simpler and quicker testing methods. What are your thoughts on this?
Well, basically, there are just two main methods, but so far we have used only just the RT-PCR-based method, which is actually very good. I mean, in terms of sensitivity, sometimes that method actually detects the RNA after some broken viruses. So what I mean is, even after there is no just infectious viruses, the RT-PCR method can detect some remaining RNA fragments. So it is very sensitive. But on the other hand, the some rapid just antigen test, this is basically just detecting the viral protein. So in terms of sensitivity, it is way just lower sensitivity compared to RT-PCR. But then there was some study, not in Korea, but in the US, and then not all the rapid antigen tests, but some the rapid antigen test shows that if it shows some positive test, which means it actually very well correlates with the contagiousness of the some infected person. So in that case, maybe some replacing the RT-PCR with the some rapid antigen test might be just another option we can just think about. And actually one of the best thing, I mean the better thing with the rapid antigen test, as that name implies, we can actually get the result right in the testing the facility, or just we can just test by ourselves. But then one of the caveat is that depending on how we can actually collect the samples, that actually affect the result, whether it is positive or negative. If it just collect the samples very poor manner, it just turns out to be a negative. Although those person can be positive and also can transmit the viruses from him or herself to other people. So there's some pros and cons at this moment.
Right, and one con would be the false negative that the test could lead to.
Right.
I see. Now, beyond national borders, Singapore was perhaps one of the first countries in Asia to declare a gradual shift in strategy against COVID-19 this past summer. Well, authorities there are still learning to live with COVID-19, and for more on those efforts, I have Professor Paul Tambaya at the National University of Singapore live on the line. Professor, thank you for being with us.
Hi, how are you?
Fine, thank you, Professor. I'll start off by asking you about this. There was a bit of a scare this last Wednesday, that is, when Singapore reported a jump of over 5,000 new infections. Now, have authorities, Professor Tambaya, shared with the public the reason for this sudden surge in daily infections?
Well, they haven't, and it's actually a small blip. You know, we've been having consistently 3,000, 3,005 cases a day. But this actually represents a small proportion of the actual new cases, because the majority of healthy young people are doing the rapid antigen tests at home. And they're staying at home, quarantining themselves. And this is what essentially living with the virus is all about. If you're sick, you go and see a doctor. If you're well, you test yourself, you stay at home. Interestingly enough, we're using tests developed in Korea, and they work pretty well, I think.
Oh, I see. Professor Tambaya, Singapore's vaccination rate stands at above 80%, and the wearing of face masks, do correct me if I'm wrong, is mandatory there. How do you explain the resurgence in cases then?
Well, you know, unfortunately, this resurgence in cases illustrates the limitations of non-pharmaceutical interventions, such as the mask mandates or social restrictions. But the vaccination rate, what it has done is it has kept the number of severe cases down. So even though we have several thousand new cases every day, we've got less than 24 new patients ending up in the intensive care unit. And we've had between 10 and 20 deaths from COVID-related complications every day. So again, that's what living with the virus is looking like for us. Large numbers of new cases, but mainly mild illnesses.
That is good to know, though. One essential aspect, Professor Tambaya, of learning to live with COVID-19, as you mentioned, is keeping track, of course, of the related death toll and cases of severe illnesses. How is Singapore once again then doing on that front?
Yeah, so we are keeping track of severe illnesses, deaths, intensive care utilization, just like I heard earlier that you are doing in Korea. And, part of the reason is that, unfortunately, the current vaccines do not prevent transmission or infection as a whole, but they are highly effective at preventing severe illness. Now, people are still thinking about the daily case number because that's what they've been thinking about for the last year and a half. But slowly but surely, we're coming around to the idea that we're going to have large numbers of cases, but what really matters is that people are not dying from the disease or ending up in intensive care.
Right. Professor Tambaya, what's your take on efforts to further boost Singapore's public inoculation rate as part of efforts to better contain the resurgence there?
Yeah, so frankly, I don't think that boosting the vaccination rate is going to contain the resurgence. What it will do is it will reduce the number of severe illnesses and deaths. And our vaccination rate is pretty good. The 84% actually represents the whole population. So it includes children who are not eligible for vaccination. Amongst adults, our vaccination rate is way over at 90%. So I think, while it's good to try and catch the last few individuals who haven't been vaccinated, I think we also want to be careful about alienating some of them through some of the policies.
Right, and talking about alienating some of the members of the public, Professor Tambaya, I understand that starting January, workplaces in Singapore will ban the entry of unvaccinated people. How is the public responding to this upcoming measure, and how are authorities preparing to address concerns that you mentioned over discrimination against those unvaccinated?
Well, the vast majority of people think that this is a good idea because they don't like the idea of people getting sick and ending up in the intensive care unit and straining the healthcare system. But we have a significant vocal minority of individuals who are very concerned for a variety of reasons, some good, some not so good, about the vaccines. And personally, I think that it's better to persuade them rather than to resort to punitive measures. The authorities have given some options, like, for example, if you genuinely have a medical exemption, you can be exempted from some of these vaccination requirements. Or if you just don't want to get vaccinated, then you have to do a PCR test within 24 hours of going into work or going into a public place where vaccination is required.
And finally, Professor Tambaya, what words of advice would you care to share with Korea as it begins its journey into a new normal starting on this Monday?
Well, I think, some of the things have gone right in Singapore, like, for example, rolling out widespread rapid antigen testing, doing away with quarantines. But some of them have been a little bit confusing with the social restrictions. I like the way you've got 3 phases. I think that's a good idea. So, you have to have certain cutoffs at which point you go ahead and press on, despite the rising number of mild cases. And so it's really important not to get hung up on the number of mild cases, but to focus on the strain on the healthcare system, to learn to identify cases early, make sure everyone is treated appropriately, and eventually we get back to normal.
All right, Professor Tambaya, hopefully that will be the case. Thank you very much for your time and your thoughts.
Thank you.
Right then, Dr. Kim, back here in the studio. Based on what Professor Tambaya has shared with us about the situation in Singapore, what do you propose to better contain a possible resurgence in daily infections amid our plans to ensure a new normal in the future?
Well, still, I believe the number one, just the strategy is to just more vaccination. Where according to what we actually just broadcasted earlier, the first shot was actually the first shot, just a vaccination. First vaccination actually completed about just 80% of the total population, but the second shot, which means just completing just vaccination now, just about just 75%. So achieving just 80% would be just very important, and also, but I think just achieving more than 80% is probably not going to be very easy. I mean, just practically. So within that, just we need to just first vaccination, and then as we just see more of vaccination, we will see more of just the breakthrough infections as well. So then I think further, I just want to just emphasize there are some personal just quarantine guidelines, especially some distancing and also some mask wearing. Still, just very good advice for just to slow down just further just spreading of the viruses.
Dr. Kim, staying with the importance about vaccination, we have been told that more than 1 million people in the ages above 60, that is, here in Korea, remain unvaccinated. What efforts do you perhaps propose to encourage those members to get vaccinated? Are we doing enough?
Maybe there's no enough. I mean, there's still just the thing that we can do just to pursue more. And first of all is about just for that people above the 60 ages, and then there's we also always talking about the risk and the benefit. For those just a group of people, benefits is much more outweigh than the risk. So then there's nothing to lose in those cases. Even just the adverse side effects from the vaccination is less just common in those age groups. So it is highly just advisable to get vaccinated for those people.
Right. Professor Kwok, should the occupancy rate within ICU units hit 75%, authorities here have vowed to put into place a circuit breaker. Now, initially, that rate had not been 75%, but 80%. Why do you suppose was the rate lowered?
Well, to the best of my knowledge, there's no set of calculation that can predict exactly at what percentage we should make a halt to this plan, and it'll just suddenly give us enough space in the medical sector to provide service again. I believe that it originally set at 80%. The government probably started thinking about the momentum after that they put on a halt to this plan, that the momentum of the transmission of the virus will still carry on to further fill up the medical sector. That's probably why they set it down to 75% of the capacity to begin the halting of the plan, so that even if it's filled even further, they would have at least a little more buffering space, still will be able to provide to other people. I think it's not such a bad idea that they have a plan to halt the plan, but I think the more important thing is that for the whole nation, people should not come into situations where we panic about rising numbers, even if that means there's a rising number in ICU beds. So I think the government probably should start educating people that this has already been anticipated by the responsible party, and that they're going to be able to take care after us, even if the ICU beds are filling up, and also maybe even if we could see a slightly rise mortality as well.
Professor Kwok, my colleagues who earlier mentioned that 55% of our ICU beds are currently available for COVID-19 patients. Does that put us in safe territory in your view?
Well, that personally, I just heard at that news as well, and I was kind of concerned because 55% deducted from 75%, it means we only have 20% left in the ICU bed capacity. But let's also remind ourselves, these ICU beds and mortality rates, they usually tend to rise not just a week after certain cluster infections as the confirmation numbers do, but rather it takes people several weeks of progression into the disease before sadly dying, or possibly at least a week to or more than a week to become more severe from the disease. So I think the current number that we're looking at from the ICU beds is not really truly representative of the case or transmission that are currently happening. So which gives us a little grimmer picture in the future, because what we can possibly face going into the next week, because we've had higher average daily confirmation cases through the last week and the week before, it is quite deducible that we might be even seeing further higher rise in the ICU bed fill up as well.
In the days ahead then.
Mm-hmm.
Meanwhile, authorities here have pre-purchased COVID-19 pills for potential treatment of 400,000 individuals here in the country. Is this enough?
Well, obviously it's not enough. And then personally, I think if some drug can be some sort of just a game changer in this pandemic, it has to be the orally available drug, like the molnupiravir with that. And then also it has to be administered to the some very early stage of the disease, which means so then it's some very mild COVID-19. So then we can actually just block the transition into the severe COVID-19, because those are one of the main reasons why there's we need more healthcare persons and also facility to just housing all those severe COVID-19 patients. And then the third one is also the drug has to be just easily accessed. which means there's some cost issues and also some production issues. But thankfully, the Merck has just announced that maybe just molnupiravir, once it is just approved for use, those the drugs at least probably some just available with a very low cost at least some low-income countries. And as far as I know, it just probably close to some 100 just countries also right now. But I'm not sure just Korea is just one of them. Probably not. But then but in addition to this cost issue, there's some production issues. So then they just securing those some full amount, for example, like more than like 10 million just doses, maybe not just quite just available at this time. So I think practically what just the government will just pursue is that if the government will use those drugs in the just patients with some mild COVID-19, but with some just high risk factors, and then probably some unvaccinated high risk factors.
Right. Also, Professor Kwak, come November 22nd, the academic arena will be fully open to students here. What are your thoughts on the timing of this opening, especially in light of the relatively low vaccination rate among school children?
That's actually exactly what I was going to mention in regards to this issue. I'm quite worried about the decision to make all these students go back to school openly is because these are the specific age group that was not mandated to receive the inoculation, number one. Number two, some of the groups actually weren't even provided the inoculation, so they have quite a possibility to become super spreaders if they come into contact with infected people. Let alone, even in the past, we've had cluster infections happen from school atmosphere and school environment, probably because these are a specific age group that are not quite controllable or socially speaking as adults. So if these kids were to actually go to certain places or certain institutions after school, mingle for themselves socially, we have no way of really taking control of them despite not having inoculated them already. And also remember that they obviously would have all these family members, even possibly elderly members in their family. Once they go home, unvaccinated person, infected person can possibly spread to as many people as they come into contact with. I'm less worried about much younger children, however, from those kids who are newly born to, let's say, 12 years of age. They have, even if they get the disease, they're much likely to have it much milder. But for the people who are teenage years to, let's say, adult years of age, they could be treated as a regular adult per se, in a social situation, and quite likely so in the progression of disease as well. So we have to give it much deeper thought how we would handle this situation in the medical regimen, treatment regimen, as well as the preventive method as in vaccination as well.
Right, well, prevention is the best answer here, so hopefully more kids will get vaccinated in the near future.
I hope so.
All right, Professor Kwak, as always, thank you very much for your thoughts, and Dr. Kim, thank you very much for being here today. Right, now do remember the focus of our strategy is to ensure a safe and sustainable transition into a new normal amid COVID-19. Thank you for watching.